Wonderful. Welcome and thank you for joining in as for the Ergonomic 101 at home. This is specifically designed for you in order to help you reduce the amount of damages that occurs at home that we do habitually without knowing. So I'd like to share some of my tips and tidbits that I share with my patients in the clinic and offer it to you. Hopefully we can make a difference in your life. And please make sure you type your questions, raise your hand, and I'll answer all the questions at the end. And here we go. So working from home, this is definitely the new norm that we're all trying to adjust to. The challenges of working from home is that we do not have the luxury of instant ergonomic support at work when we have the proper desks, the proper chairs, the proper mouses, and all the tools that could be available to you. So let's make you smart and savvy and help you be healthy during this COVID-19 crisis that we're going through as we're adjusting to our new work environment. So every day we strive to exercise more, eat healthier, and be stronger so we can have a healthier future and healthier life. Well, it all starts with our habits. What do you do the most that affects you? And that is what we're going to be learning today. I'm going to teach you what is the problem. Some of you may already know that there is a problem, and some of you may not. But today you're going to learn to pay attention to certain things that could be damaging without you even realizing that you're hurting yourself. And most importantly, okay, I know I slouch a little or I could have a better sleep pattern, but how do you evaluate that you're progressing or you're regressing? And also the awareness of little tidbits that could help you to reduce the aggravation or find solutions to reduce damages. Sitting is the new smoking. Almost more than 200 million people suffer from neck pain. Right now, this next runner-up for neck pain is upper back pain, whereas 20 to 30 years ago, it was mostly lower back pain. So our trends are changing because of the technology being introduced into our lives. Almost everybody in this world has some form of smart device. And over 45 million people experience chronic headaches. So if any of you are experiencing headaches or have experienced headache more than 3 times a month, raise your hand, because you might be at risk without realizing. And 80% of all these problems really are caused by poor posture. So looking at those animated figures at the bottom, when you are lost in your work, you forget to eat, and maybe you forget to use the bathroom, and you're so involved in your work, which one of those positions do you find yourself most? I'll let you think about that a little bit. So the cause of poor posture is by prolonged sitting, driving, which I don't think many of us are doing that as much anymore. Poor habits, previous injuries is the #1 problem that sets the stage for you to be suffering in the further years of your life. Poor ergonomics, which goes back to repetitive stress injuries. Now, poor ergonomics is not just sitting behind a computer. It could be a dental hygienist. It could be the cashiers at a grocery store. Day in, day out, they take products from right side, slide it through the scanner, look to their left. So there's a constant repetition, or even a dentist. So we're looking at a repetitive stress injury based on the industry that you're in. So ponder upon, what do I do a lot of throughout the day? Now, a self-assessment is very important. So if you were to look at the stick figure green images on the side, just look at those and tell me which one of those you think you are at the end of the evening. The day is over, you're done, laptop is closed, phone is on the side. When you walk, which one are you? See, every single one of them represents a different phase of degeneration. You don't wake up all of a sudden and look stoop over and hunched over. You gradually work your way through it. You see, the green circle, let me see if I could highlight that for you. Okay. The green circle Obviously, I'm not very good at this. Okay, the green circle on the big circle that's sitting on top of your ear, and the little circle that's sitting on top of the shoulder, that is the plumb line. That is where the earlobe should line up with the middle of the shoulder. That is a normal, healthy neck position and head position. Now, why is it so important that our head and neck is properly positioned? Is because average size of your head weighs somewhere between 8 to 15 pounds. Now, for every 1 inch that your earlobe is in front of the middle of your shoulder, like in phase 1, there's 10 pounds of pressure on your upper back, and there's 3 times more in your lower back. So that could cause a major problem in creating neck pain, upper back pain, and shoulder problems. Now, for those ladies who are listening to this webinar, if you have experienced gathering a bit of a fatty tissue behind your neck that you feel like it's becoming a little hump, that's because your head is more forward, and it causes the last vertebra of your neck, which is C7, to poke and move closer to the skin. The body utilizes that as damage, sees that as damage. So what it does, it deposits more fatty tissue in order to protect the tip of the vertebra, also known as C7. That's why most women are developing that hump in the back of the neck, because of the forward head position. Unfortunately, as you move through phase 1 and as you go to phase 2, you're going to have wear and tear in your discs and in your and the canals where the nerves are coming out. But typically in phase 1, you get the series of symptoms that are indicators, just like the red light on your dashboard when you're driving. There's a series of indicator symptoms that there is a problem brewing. And if we don't stop it now, it will become the damaging effect that are almost irreversible. So look at the list on your right side and tell me which one of these have you experienced more than 3 times in the past year. If it's once or twice, you can let it go. If it's more than 3 times a year, there's definitely something brewing that needs your immediate attention. So if you picked those items, let me show you what really happens. So looking at that, we were talking about the hump in your back, and look at the earlobe and compared to the middle of the shoulder, and that is causing almost about 4 inches of forward head position, which means 40 pounds of pressure on your upper back and neck. So imagine walking around with a sack of potato of 40 pounds on your neck all day long. Not very attractive to your musculoskeletal system. The challenge, ladies and gentlemen who are listening, the challenge is not the fact that you're overloading the muscles on your body, and not the fact that the front muscle group are balanced, trying to balance the back muscle group. The problem is that forward head carriage immediately causes the flexor muscles to roll your shoulders forward, compressing your rib cage, reducing oxygenation to your body. Reduced oxygenation causes a lot of brain fog and fatigue. It's a very fast way of damaging your respiratory system and your overall energy level, as the musculoskeletal system and the nervous system is being compromised at the same time. Now, how did this whole thing start? Is what happens to your body is when initially you feel stiffness and tightness. You get these knots in your back. You go for massages here and there, you stretch here and there, but you go back to that unsafe environment. Then you start getting pains and aches that are not stiffness anymore. And that's the progression of the problem. Then you might get to a point that you have a pinched nerve, so you feel like a radiating pain or diffuse type of pain. And that's when everything else is brewing inside while you're dealing with these problems on the outside. And then you have a blown up disc, which we don't want to go there. Now, typical pain patterns of forward head carriage and rounded shoulders, which we call in physical therapy, chiropractic, and physical fitness, we call that upper cross syndrome. So if you want to write that down, upper cross syndrome, and look up all the exercises for that. Basically, it's dividing the body into an upper half and a lower half. So When your upper body is out of its normal biomechanical alignment, when it's not properly settled, it affects a series of structures in the body. Your muscles, tendons, ligaments, joints, the attaching nerves, and the affecting visceral organs. So this is the typical pain pattern. So if some of you might be experiencing numbness and tingling in your fingers, before you jump into diagnosing yourself as carpal tunnel, follow the line. Look at your past history and see what level of your spine is coming from before it becomes a full-blown problem. Now, we send you a survey, and if you haven't received it as your thank you, we're going to resend it to you. It's a series of questions to do an assessment. Where exactly are you in the degenerative model of the spinal degeneration? Where are you? First of all, male, female, what's your age? And then typically, what's your repetitive injury type? What are your posture habits? We ask about your body biomechanics. And really what I'm trying to identify is how are you loading your body? And today we're talking about the overall sitting and proper ergonomics. But before I can tell you, okay, take this type of a chair or give you suggestions, let me tell you why it's important. Because once we know the why, then it becomes more of a proactive action. And it doesn't matter if you're at home, if you're back at work, if you're driving, if you're vacationing, you still know more about your body and know what to do in order to protect yourself. Make sure you take the survey and I'll give you a response. Just so you know, moderate is about 75% score. Moderate, if your score is below 75%, you are at severe, moderate to severe risk. If your score is above 75%, you're at a mild to moderate problem area, which means that correction is immensely effective for you. But if you're at moderate, most likely the degeneration has occurred. So look at phase 2 bone model. So if you look at the normal textbook of this vision, this is 2 of your vertebrae taken from your spine and looked at right in front. The gelatinous structure right between the 2 bones, the white structures, that's your disc space. An average height of a disc is about 3 to 5 millimeters in the lumbar spine and smaller in the cervical and thoracic spine, which is your neck and your mid-back. Look at the two yellow structures on the right and left of the bone. Those are the nerves that are exiting your body. And once your disc is reduced, that area where the nerves are exiting is also going to be compromised. So imagine driving in a tunnel, but the tunnel is half collapsed. So there might be a little jam, there might be a little traffic flow, and that's how your nervous system is not flowing the information properly, which can cause problems. You know, we all, as a chiropractor, I always talk about the physical toxicity of the body, the poor habits, repetitive stress injuries, aches and pains. But let me tell you a little bit about the neurological aspect of the body. What happens when your posture is causing nerve irritation? It can affect more than just your musculoskeletal system. Look at the nerve structure that goes to your heart and your lungs. Follow that pathway that is right in between your shoulder blades. When you talk about posture, we're not just talking about the alignment of the body. As a chiropractor and the musculoskeletal system, let's say as a physical therapist, personal trainer, exercise, let's talk about the neurological impact that your posture has on your organs. Also, tracing down, a lot of us are suffering from digestive issues. It's actually, your gut is your second brain. But before we go into neurotoxicity and the chemical toxicity of your gut, let's come back and look at the physical toxicity that's causing the nerves not to properly allow the organs to function well. You might have a perfectly healthy gut system, but if the nervous system is not telling it how to function, then the gut will become in a dis-ease state, which eventually lead into a disease problem. So correcting your posture is not just about having you look better, breathe better, stand taller, having less pain. It's about protecting your internal organs. Forward head carriage immediately affects your visual field, immediately affects your TM joints. Upper rounded shoulders, if you're a keyboard shoulder, but you have a straight posture, but your shoulders are rounded in, you'd really need to get those shoulders back up because you cannot compress your lungs. You cannot pressure the nerves that are going on to your lungs, to your heart, and also your hiatal area, which is really your esophageal area. Okay? And for those of you who might have some questions about libido and sexual function, make sure that your lumbar spine is protected, because your lumbar spine affects the organs that your reproductive organs. Ladies with menstrual cramps, it's very important to protect your lumbar spine when you're sitting or when you're standing. So think about beyond posture, think about beyond the spine, and think about your overall wellness. So to give you a visual, hopefully this will be a little bit of a summary of what we've been talking about. Is forward head position definitely affects you, causes a brain fog, your heart and lung. We talked about the digestive system. We talked about the spinal cord, and then the discs we also talked about. Now, sciatic nerve is the most common, more commonly in men actually than women, just a little side note. But very important that if you're sitting on your chair and your chair has rollers, just be a kid, roll your chair forward and backward. And if you don't have rollers on your chair, just sit upright on your chair and perform some cat curls as you're sitting. This by itself helps you. Changing your leg position, one leg higher, one leg lower, would also help readjust the position of the femur with your pelvis. And sitting upright helps reduce loading on your pelvic area, right? And definitely moving your ankles around would reduce that compression in your leg or causes restless leg syndrome. Now, we talked about the physical factors that you need to consider. We talked about the chemical factors, the mental factors of the effect of the body and the effect of the physical body on the mental and the chemical aspect. So it's not just about slouching, it's about protecting you from inside out and outside in. Unfortunately, the mental side effects of poor posture and pain are what's costing billions of dollars a year. It can cause depression. Pain does cause depression, just so you know, and getting you out of pain and into a proper position would help you. If you have trouble concentrating, definitely work on your breathing, definitely work on your posture, and also inability to sleep well. Let me ask you something. If you are slouching all day long, and if you have poor posture and you're in a compromised sitting position and your body is accepting all that load throughout the day, how do you think it's going to feel at night? So to protect your sleep, take care of your waking hours so your rest time can be most effective for you. So, you ready? Here we go. What are your solutions? Definitely, if you have numbness, tingling, sharp shooting, stabbing, radiating pain, make sure you seek medical attention. Those are neurological symptoms of the body. Pain management is extremely effective. You could see a pain management specialist, a chiropractor, physical therapist, orthopedic doctors. Medications, as you know, I don't even own a medicine cabinet in my house, but if you are taking medication, make sure you consult with your medical doctor and ask them for alternative. What is an alternative to cortisone, and what's an alternative to other pain medications? Prevention is the most important. So as you're protecting yourself, prevention is also very important. Stretch the areas that are causing you the most amount of achiness. Bracing. If you know that you have a problem and you're slouching, using bracing is very important. If use supports, breathing techniques, very effective, very important in how you breathe. Take a deep breath in as you sit upright. And if you have a hard time sitting upright, sit against the wall. Breathe into your stomach. Don't breathe into your lungs. And then exhale out of your stomach. This activates your entire mobility of your spine. So if you breathe with me right now, just take a deep breath in right now. Breathe in and fill your stomach and let it just blow out as much as you can. And then exhale. This would help you immensely. I know I have these blinking, I don't know. Okay. Now, protection, ergonomic, work safety, bracing, support, and strength exercises are very important. If you are a sloucher, please make sure you stretch your front of your body, which is your flexors, and strengthen your extensors, which is the back of your body. So we're talking about lats, traps, glutes, hamstrings, and stretching the quads, abdominals, pecs, and anterior scalenes, or front of your neck. And then the natural way. If you like to resolve the problems, the natural pathways are chiropractic, acupuncture, massage, herbologists, or using herbs and physical therapy and stretching. So, if you want to assess yourself, this is what you do. You stand in front of the mirror and you have these areas that you need to check. Look at yourself in the mirror and look at your earlobes. Do they line up? Look at your shoulders. Is one higher than the other? Look at the curve in your waist and look at your hips. Is one higher than the other? Is one more rotated than the other? Ladies and gentlemen, men, if your pants zipper slides to the side by the afternoon, you have a pelvic rotation issue. Ladies, if your skirt shifts on you, you have a pelvis rotation. If the hem of your pants or the line of your stomach is one side higher than the other, and you always have to alter one side compared to the other shorter, you either have a foot problem, a pelvis issue, or a scoliosis in process. So a couple of little tidbits. Check your knee level. Are your kneecaps in the same place or one is higher than the other? Check your inner ankles. If you have children, this is the best way. Lay them on the floor, have them grab their ankles, tap their feet together, tell them to take a deep breath in, close their eyes, hand on the side, and you monitor how they hold their head, their shoulders, their pelvis, and look at their feet if one is shorter than the other. Now from side, that line is called a plumb line. It's a straight line that goes from landmarks, exactly what your posture should be. Your ears have to be lined up with the middle of your shoulder. That runs through the side of your hip, side of your knee, and side of your ankle. When you go out for walks or when you're exercising, and if you're in the gym, please, if you don't take anything out of this webinar, please make sure your earlobe is lined up with your shoulder. If you just remember that when you're walking and when you're exercising, you're already 50% there. So why is it so important to sit upright? When you're standing, there's about 100 pounds of pressure on your lumbar spine disc. When you lean forward, like in the last image, that's 350 pounds of pressure. So if anybody's listening who is an attorney, an accountant, or tends to sit 6 to 8 to 10 hours a day, don't be surprised if you get a blown up disc and you've been sitting all day long or all throughout your professional life. It's the prolonged pressure on the disc that causes us to blow out when you just bend over to pick up a pencil or a paper. So keeping your posture is a daily task. It's very much like brushing your teeth. It's very important to take care of your body on a daily basis because it definitely has a high ROI for you in your later years. So for those of you who do standing desks, make sure that the height is properly adjusted to you. So when you stand, you want to make sure that it goes from your elbow height down to your feet. And then make sure your monitor is at your eye level. So most ergonomists recommend middle of the arm monitor to your eye level. You can even find out how far your monitor should be from your eyes by extending your arm straight forward. Wherever the tip of your fingers touch, that's where your monitor is supposed to be. Now, here's a little tidbit. if you move your screen by about 10 to 15 degrees higher, you actually help promote a proper curve in your spine, in your neck, which means that because at this level, you have a straight neck. But if you move your monitor slightly about an inch or an inch and a half, depending on your height, you actually notice that you're looking slightly higher, just a little chin tilt up. That's where the best position would be for your neck. It reduces your upper back pain. It reduces the cervicogenic headaches or headaches that happen from the back of your neck, go right behind your ear and land on your forehead. Those are called cervicogenic headaches. And making sure that your elbow has a rest place. Why? If your elbows are resting on your elbow armrests, it does not allow your shoulders to be raised up to your ears. When you're working, you notice that if your elbows are dropping down, you notice that your shoulders elevate and your head just dives into the monitor. So keeping your elbow down is what's going to help your shoulders and your upper back muscles to relax. So focus on your elbows, use the armrest on your chairs, and sit properly. The best height to have is to make sure that your torso makes a 90 degree, when you're sitting, your torso makes a 90 degree with your thighs. So that is the best position of the body, and your thighs makes a 90 degrees with your feet. Now, we can adjust this angle of the femur to the legs, the thighs to the legs, by either elevating the leg, with putting it like a little footrest underneath, or by elevating the seat, which changes the angle of the femur. But your torso has to be in proper position. Now, so just to get a visual, comparing to a poor posture, and look at his elbow, whereas being in a proper position. All right. So, when you're purchasing chairs, it's very important to choose them wisely. These are two most popular chairs. If your chair has a neck support, make sure the neck support is not forcing your head to be forward, because that promotes reverse cervical curve, which is extremely a progressive aggravation to degenerative joint disease or degenerative disc disease. If that headrest is bothering you and forcing your head to be flexed, take it out or readjust it. The elbow rest has to be flexible so they can go side to side on the elbows, so your arm is properly positioned. If you're getting a lumbar support for your chair, make sure that lumbar support is properly positioned above the two dimples in your back. Don't bring it as low as possible. If you feel like you need to bring a lumbar support all the way down to where your buttocks is attaching to the seat pan, then you really need a seat cushion, not a lumbar cushion. So, because that would mean more of a sacral issue, more of a pelvis issue. For a lumbar pillow, you want to make sure it's right in the transition of the curve in your lower back and curve in your mid back, where we call that transition in the thoracolumbar area. So adjust the lumbar spine so it forces your body to be upright. The second image, where the headrest is on the chair, if you notice, the elbow is a little sharp at the edges. For those of you that are using the keyboards quite often, that might cause you a compression syndrome in the nerves in your wrist. So make sure that your elbows are nice and cushiony, not hard. You could always get a gel pad on top of them. That's your choice. So what are the tidbits that you can have? What are the protection and prevention methods? So what do? Look away from your monitor every 30 to 45 minutes. Now, thankfully, to text messaging and distractions from the phone, we automatically do that. But preferably, I need you to look far away. Why you do that is because when your eyesight is fixed at one specific distance for a prolonged period of time, it causes dry eyes and it causes reduced contraction of your irises, which causes muscle fatigue in your eyes. So looking far away, as far as possible, for about 5 to 10 seconds allows your eyes to readjust and exercise those eye muscles. Also use a diffuser to reduce dry eyes, and definitely either take vitamin E or use vitamin E oils on your lashes. Now, wear posture supports. For those of you who just dive into your work and you don't know where time flew, make sure you wear a posture support. It helps to retrain muscle memory, and I recommend BAX-U because it's tested, it's examined, and it took us 2 years to figure out how not to compress the armpits. Adjust your work area based on the information that we provided for you. And as a thank you for attending, we will share this PowerPoint presentation to you, and we will also share links of where would be the most ideal chairs, ideal supports, and also ideal sit-stand desks that you could have. And also take a break every 5 minutes for 1 hour of work, if you can. That break could be not even leaving your desk, but let's say take a break. In the morning, 10 o'clock, you stretch your neck. 12 noon before lunch, you stretch your wrist. 2 p.m., stretch your back. So you could even do cat curls where you're on your seat. 4 o'clock, definitely stretch your legs, whether it's stretching your hamstrings, kind of crossing your leg, your right ankle on your left knee to stretch your TFL and stretch your performance muscles. Use a wall, use a chair or a floor if you can, if you're working from home, so that should be easy. But stretching and taking a break and interrupting the pattern of muscle spasm is very important. Pelvic tilt when you're sitting is very effective, especially if you have digestive issues, sciatic problem, performance syndrome, knee pain, constipation, diarrhea. Very, very important to do your pelvic stretches while you're sitting. You could do 3 sets of 10 and just put it on speaker and listen to your long emails or webinars, but you can actually move when you're listening. Or play music and dance. If there's any Latinos, play any kind of fun hip music and just dance. That's the best exercise you could have. And seated back curls is basically stretching your whole full body. Meditation, deep breathing, not only increases your cognitive abilities, but also allows you to deal with daily problems a lot easier. So you don't clench your teeth, round up your shoulders, and become more posture problematic. So what kind of a posture support is out there? I want you to pay attention before you spend money, because I have lived with the philosophy of I'm not rich enough to spend money on cheap stuff. So that's my philosophy. But let me share with you why. When you go on Amazon, you get an assortment, anything from $15 to $100 posture supports. Just be aware, you want to choose a posture support that does not compress your armpit, because if you do that, you're causing a compression of a group of nerves that come from your neck and feed to your hands and fingers. So if you put your thumb and your index finger together, that's called C6. And if the third finger is your C7, which is coming from the 7th level of your neck, and the ring finger and the little finger, those are coming from your C8, which is where the hump happens, the connection between the neck and the upper back. When you compress those nerves, you pressure those 3 nerves that are coming out of your neck to feed to your hands. So some of you might be misdiagnosed with carpal tunnel syndrome because you're having a compression on your arm, on your brachial plexus. They call that area brachial plexus. When purchasing a posture support, make sure it's not compressing your armpit. That is the key, or else you wasted your money, you wasted your time, and you're brewing another problem without even realizing. Second, it has to be adjustable. If it's not adjustable, then you can't play with it, and it cannot be too hard. Your poor posture occurs by 1, slouching, which is your thoracic spine, immediately after followed by rounded shoulder, and followed through by forward head position. So taking a posture support that one uprights your body, retracts your shoulder is very important. That's why we did our testing specifically with BAX-U, and this was the results that we had. So we use a technique called surface EMG. So for those of you who have experienced that, is basically measuring the amount of muscle contraction. And on the graph on your right side, the yellow were the participants that we measured their muscle activity. The red is the strength of their muscles after they wore the BAX-U posture support. And the graph on your left side is basically changing the thoracic curve, or what was the average change in the thoracic spine? How much were we able to move the body back into upright position? I hope this was a productive, effective, and helpful webinar. I thank you so much for listening, and I hope I was able to add a little bit more health and awareness to your life. Have a wonderful day and look forward to hearing your responses. And I appreciate a survey completion at the end of this webinar. Have a wonderful day and wish you much well.